All I want for Christmas is 2 pink lines, but those 2 pink lines are possible. Miracles take a little time. IVF treatment is not a taboo, that it is painful, it is expensive, it always fails the first time. All infertile couples, they require IVF?
Not at all. Miracles take time.
How long do the eggs last, ma'am?
The eggs are frozen, you have to take up an IVF procedure.
That is really amazing gift that you're giving to women, ma'am. Hello everybody, welcome to VQ Podcasts. Today, I'm going to introduce you to a person which I think I can say all I want for Christmas is 2 pink lines. Now, I have someone with me who will tell you that miracles take a little time, but those 2 pink lines are possible. So welcome everybody, Dr. Kamini of the famed Vani IVF. Welcome, Dr. Kamini.
Thank you so much. Thank you.
So, Dr. Kamini, I think everybody is aware of Vani IVF centers because I think there are about 8 all over Gujarat.
Yes.
I think 3 or 4 in Ahmedabad itself,
yes,
and 4 outside.
Yes.
And you are helping so many women complete the dreams of becoming a mother that I think by default you are a very, very famous personality. So I don't think you're a stranger to any of my listeners or any of my subscribers.
Hope not.
No, you are not, ma'am. So what we would like to know is, when did you start your journey? I mean, when did you become a gynecologist? And how did this dream of IVF start?
Like, I became gynecologist in '89, and just then I had decided that I will be an IVF specialist. Like
In 1989, ma'am.
Yes.
But I think IVF concept was a very unexplored sector at that time.
Yes, exactly. But then I had to explore. It was a hard journey, but still, and hard and a long journey, isn't it? So I had decided then. In 1991, I had my training in London. And after that, there was a gap of 10 years. And in that 10 years, we prepared for everything. Of course, I had to complete my family and preparation for this. And I started my journey in 2000 for IVF.
So 1989 to 2000, a very, very long wait. I knew that IVF was possible, but in very few centers, I think back in 1989.
Yes.
And I think it's become more famous now in the last few years.
Yes.
And that is when you actually jumped in. But what I think sets you apart from the other IVF centers is that you offer your services in tie-up with other gynecologists as well. And I think this is not very common. So that is what sets you apart. So how did that happen?
Like, looking at the work at the periphery, the patient had to travel very long to a metro city. And that's what inspired me, that why not in periphery? So it was better to have a stable gynecologist in periphery where they can answer all the questions for the patient, and patient always feel that they have somebody in that place. These are the places where patients had to travel very long to come to us. Like, of course, it's not a pregnancy or a delivery that they have to travel every 15-20 days, but still it's a pretty long journey for IVF patients.
Which is traumatic by itself.
Exactly, and emotional trauma is much involved. And after doing the procedure, when I come back, I need somebody who's answerable to the patient, and so they don't have to travel so long to meet me. And there is somebody who has been trained under me, who's looking after them. And this is how the concept started developing. And it's
one of our guests, Dr. Karishma, was, I think, associated with you.
Yes, she is still.
She's okay. Still. So that is the reason that we actually came to know that, you know, the main person to connect with is Dr. Kamini. So which are the new centers? You have 8, you said.
Like,
so which are the places?
We have our headquarters in Maninagar, and we have in Memnagar. We have an upcoming center in Nicole, where they have a platform to serve as an IVF specialist. And basically the junior IVF specialist who has a passion, like I had a passion, but I didn't have a platform. So here the platform is there. So gynecologists who are trained, or maybe they are passionate about IVF and infertility treatment, they have a platform ready. They just have to come and join. That's it.
So Nicole, and what about outside Ahmedabad? Which other
Baroda.
place?
We're
Baroda.
coming up with Baroda.
Okay.
And we'll come up with Nadiad as well.
Okay, because you have got subscribers all over Gujarat.
Yes.
So people would be interested in knowing where your centers are.
Exactly. So Baroda is coming up on 23rd of March.
And all are known by Vani IVF.
All are known by Vani IVF. And Nicole will be end of April. And maybe by end of May, we'll come up with Nadiad.
Okay. Ma'am, we already know what sets you apart. Now, I would like to know which are the kind of people who can benefit with an IVF treatment. So, what kind of clientele is the ones who actually visit you, ma'am?
All the couples who are infertile.
Okay.
Infertility is like, you cannot, it's not age related. Infertility is a need related. When there is a bilateral tubal block, we don't want to wait till 40. Like, people do have that concept, like our age is not much, so we should not end up having an IVF treatment. IVF treatment is not a taboo. This is what I want to convey to everybody, because everybody takes it as a taboo, that we don't need IVF treatment and we want to go naturally. This is what I get to know from all the couples, and this is not an unnatural process. I never tell them. So I always ask them, is it an unnatural process? No, it's very much natural. So it is only an assisting them in their reproduction. And that's why it is called as an ART. ART is assisted reproductive technology. So we only assist them. So when they tell me that we want to try naturally, in spite of having bilateral tubal block, when both the tubes are blocked, why? I mean, what are they waiting for? Natural process. When there is a natural process, the tubes have to be open. Now, when there are no eggs, absolutely 0.001, and they want to try naturally. So this is what I want to convey the message. When there is an indication for IVF treatment, what are we waiting for? And IVF is not an unnatural process at all. We are just pushing, there is a hard rock which needs to be put from this place to that place. What do you need? 2 people, 3 people just to push? This is what we are doing.
I think basically, ma'am, people have heard from other people who have undergone IVF that it is painful, it is expensive, it always fails the first time. These are the things which go about in the market. So that is why maybe it has become a taboo.
Maybe.
But what I wanted to know is, are all infertile couples, they require IVF?
Not at all.
Only the ones with tubal blocks.
Bilateral tubal block, or maybe the males having an azoospermia. Because when there is an azoospermia, there are no sperms at all, we need to do a process called as PISA and TISA. These sperms are aspirated from probably epididymis or testis, but these sperms cannot fertilize the egg naturally. So what we have to do is take up an IVF procedure, take the eggs out and take the sperms and fertilize them. So here in this case, what natural process we will be waiting and what unnatural process we are doing, isn't it? We are just helping them out. So these are the patients where they absolutely need an IVF procedure. ART procedure is not only IVF procedure. ART procedure consists of so many treatment, like an IUI. That is,
and all these are offered at Vani IVF?
Yes, there are so many other treatments also, alternative treatment available other than IVF treatment, isn't it? But they need to come. So for all the females, God has made a tapering, because highest fertility is at some age, and then the fertility declines for all the females. The decline age for Asian ethnicity is 32 to 33. So after 33, there is a decline. So all the ladies have to understand that there is somewhere there will be a
biological clock is ticking, basically.
Exactly. So when there is this biological clock ticking, and then on top of it, we want to still wait till you age completely. Your uterus is tired, and then at 40, we are stuck. Now we want to take up an IVF treatment, and doctor, you are not giving us the result. That's the problem. And then 40. They enter in the center and immediately they want in 1 month. Nature has awaited for 10 years of your married life. You don't want to wait for 2 months?
That
for
I think
nature to
happens
work.
in all the places, ma'am.
And ekdam, like you become so impatient, like immediately the God has to give the result. God also takes time, you know. Miracles take time, isn't it?
Miracles take time. Very true, ma'am.
Correct.
So, ma'am, the kind of couples who come to you, are they only couples, or you get single women also? And if so, what would their reason be for coming for an
Well,
IVF?
yes, single women are there, but very less, like maybe I would say 1%, because maybe social
The
taboo.
social taboo.
Social taboo. There are so many young girls who are coming for egg preservation, especially the girls who are career oriented and working abroad. They do come down and preserve their eggs. The best age to preserve will be around 30 to 35, because before that they do want to wait for the partner probably. If they
Okay.
find a good partner, they'll definitely take up the family.
But so in
if
these
at
cases,
all-
the eggs are implanted in the female and the natural process is allowed?
No,
Or you
so
do it IVF only?
it is
You
only
cannot
IVF.
do it in a
Once
natural
the eggs are frozen, you have to take up an IVF procedure.
and then it is inserted in the womb later on.
Exactly.
Okay.
Once the embryo is there, you have to transfer the embryo.
Supposing, ma'am, the one of the partners doesn't have an egg or has azoospermia, as you mentioned, doesn't have the sperms. So in this case, maybe need to take from a bank donor. So also we have any kind of a donor facility in Vani IVF?
Yeah, but then we do want that they should have their own gametes. So we try till
But
the
suppose
last
if it's
drop.
not possible.
For azoospermia, as I said, TISA-PISA procedures are available. Out of 10 males, we do retrieve from about 9 males. Hardly 1% of the male, they would require a donor. But that also, they do try a TISA-PISA procedure again after 3 to 4 months. And in 2 procedures, if they don't get the sperms, they may opt for the donor sperms.
And
we do
what are
have
the
a bank.
legal issues surrounding the donor?
Yes, we do have they have to take up an legal procedure for a donor affidavit. Both the couples have to sign the legal affidavit that they both agree to take up either donor. Even if the eggs are not there, they agree on taking the egg donor. Even if the sperms are not there and they have tried the level best after doing 1 or 2, 3 procedures of TISA-PISA and they don't retrieve any sperms, they do, both the couples agree. We do have a sign on a stamp paper and an affidavit for it.
And donor banks?
Any willing person.
Okay, but only when required, or is it the general?
No, they do come and bank. For
Okay, and
male
they are
donor,
allowed.
banking is allowed, but for female donor, it's only 1-to-1.
For her own self?
No,
generally.
for female donor, it's like for one donor for one couple.
Okay,
So
so it is
only
predetermined.
when there is a need, we do have a donor.
So it's predetermined that this couple is going to take from this donor.
Female donor.
Whereas in
Yes.
sperms, it is not like that. The donors are there and
Yes.
and there is affidavits and the legal procedure is all
Yes,
there.
once we complete, we can take up.
What about surrogacy? I have heard that sometimes it's not always the azoospermia or the lack of eggs, but the womb is not in a position to get a baby.
Correct.
So they need to rent a womb as such. So in that case, the sperms and the oocyte is of the couple.
Yes.
And then this is fertilized IVF, but it is inserted in a surrogate. So
yes.
what are the legal issues in that case, ma'am? And is that clear at Maahi IVF?
Yes, we have a clearance. Our center is registered as a surrogacy center. But once you register, you have to follow all the government protocols, what are in the ART law of surrogacy. So once the couple comes to us, whether this couple is eligible or not. Now, what is eligibility? Whether the couple, the lady doesn't have a uterus at all. There are some syndrome where the lady doesn't have she doesn't have a uterus, but she does have an ovary. So her egg is, definitely we can take her egg. And in some cases, the uterus is not capable to sustain the baby for 9 months. So they may have a repeated abortions, or maybe there is an Asherman syndrome or tuberculosis of the endometrium, multiple cases like this where uterus is said that this uterus is not capable to sustain the child for 9 months. So when we have a certificate like this, that this uterus is not capable, then these type of couples, they do come and ask us. Then the procedure is quite simple. Like the egg is from the lady, sperm is from the husband, and the
womb is from the surrogate.
Surrogate, that's it. So the 3 parties.
So a lot of combinations and permutations carry on, but because of that, the dream that a lot of women have of becoming mothers is probably, fulfilled because these permutations and combinations are possible.
Yes.
And they are possible only because IVF is there.
Yes.
So that dream which you had in 89, ma'am, and which you've actually done in 2000, I think that's really wonderful.
Persistence.
No, more than persistence, I think there are so many. My sister is one of them. Like, she always wanted a baby and not able to have it. And I wish I had known you earlier. I would have definitely. She is now in Australia. But I wish I could have connected her to you, and maybe her dream would have come true. And I had my baby at 40. And when I had it at 40, the biggest fear that I had, that, my eggs are old,
yes,
and
exactly.
it's going to be a Klinefelter syndrome or a Down syndrome.
Down syndrome.
And I got all my Dopplers and all that done. So that fear would be there with a lot of ladies who are, concentrating on their careers. And for those ladies, having the option of preserving the egg at the beginning of their career, it's a boon.
It's a boon, yes.
It's a real boon. And then at a later date, when they do find a partner, they have the option of having their own baby from their own egg. So that is something that is really amazing gift that you're giving to women, ma'am. I have also heard, ma'am, that your daughter is a geneticist.
Yes, exactly.
Okay.
And there are so many other diseases, genetic disorders as well, where we can scrutinize and transfer a healthy embryo, where the parents are, rest assured that even if they are having anything minor in their genes, it will be, weaved off. I cannot say, because all the genes, it cannot be cured. But for the next gen,
you can be safe.
Off.
So any couples who know already that they both have thalassemia minor, in those kind of couples, it is safer to get your embryo biopsy done at your place and go in for an IVF procedure to have a healthy
select
baby.
a healthy embryo.
Exactly. So this is another new kind of a therapy that we can think of. A new gate.
A new gate.
So I think basically as medicine advances, more and more options are available, and most of these options are already available at Vani IVF.
So true.
So it was a real pleasure talking to you, ma'am. And I'm sure our subscribers and our listeners have gained a lot of information today. And thank you very much for that.
Right.
I would like to end by asking you to give a little message to those infertile couples out there, and the ones who have completely lost their hope. I would like you to shed a little bit of ray of hope for them and a little message.
Definitely. One line message is, don't have a taboo to enter an infertility center. Why should you be? And who are you answerable? Nobody. For yourself. You are answerable to yourself only. So why are you worried when you are entering an IVF center? This will watch or that person will know. Don't worry. Nobody should worry. You should take the treatment right away and see that your family is completed at right time. That's it.
Thank you very much again, ma'am. Thank you so much.